Hey y'all, welcome to The Skintrovert. I'm your host, Sam Bazile. I have a little treat for you guys today. So I asked Jamison Williams to join me for a very unique topic that I think some of us don't normally get to speak to because we're women. We're women in this aesthetics industry. And according to the standards, we're right where we need to be. But what about men? What about men in this industry? Where do they fit, both provider and patient? What makes them unique and how is their approach a little bit different? So that's why I think y'all are going to really enjoy Jamison's take. I have gathered lots of very interesting questions to ask him. And just a little backstory, Jamison is someone that I've followed for a while. He has such a kind soul, and that just resonates through his content and the way that he puts himself and his business out there. I have always appreciated his content. I've appreciated his passion. Him and I share a passion for a specific skincare brand, and that is what joined us together. And I think you guys are going to fall in love with Jamison just as much as I have. All right, let's welcome Jamison and join us for The Male Aesthetic featuring Jamison Williams. Hey, y'all. Welcome to The Skintrovert. I am so excited. I have probably one of the kindest souls joining me today. I am super excited. So, Jamison, you want to give a little intro and tell our listeners a little bit about yourself?
Yeah, sure. My name is Jamison Williams. I'm a CAN certified aesthetic nurse practitioner in West Hollywood, California. I'm the owner of Beauty FX by Jamison right here on Sunset Boulevard. I'm looking out at the Hollywood Hills from my office window right now.
Lucky you. I'm here in the
It is a
swamp in
pretty great view.
Louisiana watching all this rain. Like we've had
Oh
rain
man,
for days, but
it doesn't. I don't know what rain is anymore.
lucky you. Okay, so I'm going to jump right in because we have a lot to talk about today. You bring a very unique approach to this because, as I mentioned in the intro, a lot of us that are in aesthetics, we are women. And like it or not, women have a very different perspective on everything than a
Yeah,
male perspective. So I think it's very interesting what you bring. And it's not just you being a male that's so unique, it's your talent, it's the way that you take care of your patients. It's a lot. So we have so much to talk about, but the first thing I want to talk about is your uniqueness, especially with your practice. So your practice is unique because you see about 60% of your patients are men. How did that
yeah.
happen?
It kind of happened by accident. I didn't really, plan it to be that way necessarily. I, at previous practices, most of my patients were women. But when I opened Beauty FX, I saw a need for, men to have a place that they can go where they feel safe and where they feel comfortable talking about things. That's why my office is, navy blue and gold. It's very, gender neutral. I wanted a place that would feel warm and inviting for men and women, because men are scared of aesthetics. Like they see the bright pink walls and they see they see all the results floating around, and they get scared to even have a conversation about having anything done. So I wanted my place to be very welcoming for all genders and all people of all of all everything. And I think it just kind of went from there as people, especially in the community here, I see a lot of men. A lot of them are gay men, because I'm in that community here in West Hollywood. So word kind of travels fast in communities like that, as you know. So as people started coming to me and getting those natural results, their friends knowing that they had friends that went to me and they don't look crazy or overdone. I think that built a lot of trust in the community, because I knew very for certain that if I were to be leading people the wrong direction, that pipeline would stop.
Yep.
All it would take was one bad result, and everybody would know about it, and nobody would want to come to me anymore. So
Right.
I think it's just consistently showing up and being true to my brand and who I am, for both men and women. And I think that's what's helped, build that client base.
Okay. I appreciate every bit of that. And I kind of have a little bit of an idea of what you mean by that. So, I mean, my husband's not gay, obviously he's my husband, but me being in this space and just being in this industry for so long, he was not into it in the beginning.
Yeah.
He wouldn't even use skincare. He was very, not doing any of this. Is all for women. It's a women thing. It's a woman's run thing. But it took us, we went to, it was like a little like reunion, a high school reunion. And,
Yeah.
he used to always give me a hard time about all the things I do. Like, oh, the skincare, the injections, it's just so much. Well, we go to this thing, okay, with all of our old high school friends. And that night, he came home and he was like, wow, she looked really rough. I said, yeah, I know. That's why I do all this. So it was literally that night when we went home and he's like, all right, just tell me what I need to do. Just like give me the routine. And I said, all right, I'm in. And
Yeah.
now, of course, his skin looks better than mine. That's how it works. But
Yeah.
there was a difficulty kind of getting him into the skincare and even harder getting him into a clinic to go try Botox
Mhm.
and try the things because like he was so embarrassed. He felt like, what if somebody sees me going in there? So there definitely is a little bit of a stigma in the straight community for men. So
Absolutely.
I hate to say that there's a difference, but there is. I feel like
Mhm.
gay men are a little bit more vain. Like they want to take care of their appearance. They want their skin to be pretty. They want things to look good. But
To a
when you
point.
find straight men, yes, I feel like
Not
straight
as
men is a little bit
with
different,
my
right?
clientele, not as much as you would think. They run very much in the same thought vein as other men. A lot of that 60% are gay men, but I do have a lot of straight men as well, and most of them came to me because their girlfriends or their wives or their female friends in general came to me first. So like, oh, okay, this is a guy that he would like. He would trust this guy, and then they convince them to come in, and then they're like, okay, you're cool. You look normal. You talk normal. Like you're a normal guy.
You weren't turned
Um,
into a woman. Okay, we're good.
yeah, exactly. So, and I mean, I've been at social gatherings, house parties, things like that, where somebody will find out what I do, and they're like, "Oh, I don't want to do any of that. That's too much." And I'm like, "Look around this room. There's about 15 people in this room that are patients of mine. Do any of them look weird or crazy or overdone or fake?" They're like, "Really?" I'm
I
like,
love that.
"Yeah." I'm
I
like, "Yeah,
love that.
that's the point. You're not supposed to notice."
That's
And
right.
once they get that in their mind, they're like, oh, okay, this can be done naturally. This can be done. I don't have to just deal with it.
Well, I love that. I might have to have my husband come see you because he's struggling around these parts. All right. So you mentioned treating both men and women. Obviously, the larger portion of your patient base is male, but with your experience treating both men and women, do men and women usually come in asking for different things?
They don't really ask for different things, but they may ask for them in different ways.
Mhm.
So there's a spectrum of aesthetic results and what people consider natural, right? Think of it like the way you dress or the way people dress in general. You have one end of the spectrum where, like me, I'm on one end of the spectrum where I'm a jeans and a t-shirt guy. If when I'm not in the office, like in a button up, I'm jeans and a t-shirt or gym clothes. Like I don't care about getting all fancy and putting on super nice clothes everywhere I go. That's just not who I am. But then on the other end, you have people that love to get all dolled up. They love to put on the nice clothes. They like to look fresh all the time. And both of those are perfectly acceptable ways to dress. And aesthetics kind of has that same spectrum. You have the people who are just like, I just don't want to look so tired. Like I just want to look like I'm putting in a little effort to take care of myself, but I don't necessarily want to look like the other end of the spectrum. Again, perfectly valid end of the spectrum where, and this is more where, the men normally fall on that one side, women usually fall on this other side. And generally in the aesthetics industry, not necessarily my patients. But you have the other end of the spectrum where people, like I put a lot of effort into the way that I look, and I want people to know that I put a lot of effort into this.
Mhm.
Not necessarily wanting the work to be obvious or overdone, but like the more glam side of
Yeah, I
things.
get that.
And both, again, perfectly respectable ends of the spectrum. um, and both are great, both are fine, both can still look natural. So natural is a spectrum. So I think that men and women generally fall on slightly different ends, but you have some crossover there in the middle where some men do put a lot into their appearance, and they want to look like to look super fresh. And some women are like, no, that's not me. I just want, again, I just want to look like I take care of myself. Men are usually also a little more direct in what they want or what their problems are. Like men are more likely to point out a specific issue, like these lines are getting to me, or I look tired, like my eyes are dark. Whereas women, a lot of times, will be more general, speak in more general terms. Like I was like, I don't know. I just feel like I feel like I look old lately. I feel like I look tired. And I always kind of have to pull it out of them. Like, what's making you feel old? What's making you feel like you look tired? Is it your eyes? Is it your mouth? Is it your neck? Like what? Give me something to work with here. So I have somewhere to guide you. So yeah. So basically to answer your question, they generally want similar things and are asking for similar things. They want to look natural, they want to feel more refreshed, they want to look less tired, but the way they ask it and the way they define natural is a little bit different.
Okay. So, with that said, I love how you keep using the words natural as opposed to, doing the work and getting things done. And we'll dive into that. But if there was a male patient that is feeling a little bit intimidated about aesthetics, what advice would you give someone that's curious but feels a little bit intimidated?
um if they're curious but a little intimidated, I try to I tell them just come in for a consult. We don't have to plan on doing anything. We don't have to do anything. Like, let's just talk and dig a little bit more into what's concerning you and what you're afraid of. Like, what is making you hesitant? Is it that you're afraid to look overdone? Is it that you're afraid it'll change who you are? Do you think it's just you being vain and you should just deal with it and be more confident in however you look, which is valid. But like, what is giving you the hesitation, and what things can we potentially do to make little improvements in certain things that are going to make you help, that are going to help you feel better about the way you look and how you present yourself without changing, who you are. Because there's a ton we can do that's not even injectables. That a lot of men, once they realize there are options that are non-injectable options, that aren't going to change the shape of your face or necessarily the volume of your face, and just help you look a little more refreshed. I use that word a lot. I think that's where I would tell most people to start, is just let's have a conversation. Conversation's not a commitment. Conversation is just a conversation. You can ask questions. You can talk through what's concerning you, what you're worried about, and we kind of go from there. If you decide to do nothing, then we decide to do nothing.
I love that. That breaks down that wall. It makes them not, there's no pressure there. There's zero commitment. This is just a conversation. That's
Mm-hmm.
what I think how everyone needs to approach dipping their foot into aesthetics. But
Oh,
there is
100%.
something that brought you and I together, and that is skincare. You and I have a passion for a specific brand. But I will say this, do you feel that, especially with men, I think they don't understand that skincare is also for men too. And
Mm-hmm.
they don't necessarily understand that that's a huge part of this whole entire treatment plan.
Yeah.
So, if there was a male patient that was a little curious or a little intimidated and they had to start somewhere, would you say that skincare would be a great first start?
1000%. That is normally my first recommendation for anybody. Because generally, men over time don't take care of our faces as well. So, like, our skin's in a little bit worse shape, before we even consider things like lasers or injectables or anything. So, if you don't have a good canvas, you're not going to get good results from anything else. So, if they're hesitant about doing anything, I'm like, okay, let's at least, while you give it some thought, we need to start at least working on your skin, because it's about the health of the skin. I tell all of my patients, especially my male patients, I don't care about making you look pretty. That's not what skincare is for. Skincare is not to make you look pretty. Skincare is supposed to care for your skin. It's supposed to help it be healthier and help it look healthier, not just, actually be healthier, not just look nice. And that usually helps them start reframing the world of aesthetics as it pertains to how I approach things, because I don't want to make you look, all done up. I want to help your skin function better. I want to help it be stronger and more resilient and help with some of these issues that you're having skin wise. And, you know, starting there is a great starting point. It's the perfect starting point, actually. And that's what I encourage my patients to do anyway, whether they want to get all this other stuff done. If I notice their skin's in bad shape, I'm going to tell you, I want to start with your skin.
There's a lot, and I'll say this, just doing this podcast, I promise that when I did this, I would be very open-minded because a lot of times I know I don't know everything and I know that there's still a lot to learn and I will always remain teachable, but sometimes I get very like stuck in my ways and how I think of things. And so I
Mhm.
always said, doing this podcast when I would have guests on, I was always going to be open and let them share their opinions, even if it changed mine. And I will say that is probably the one thing that has been the commonality between me and podcast guests and other providers that I work with in this industry, that skincare always has to be where you start. And
Mhm.
really, if you're not going to do everything, that has to be the one thing that you commit to doing. So I'm so glad that you are in line with that, which I knew you would be.
Mhm.
Okay, so let me talk about this. You have said this several times since this started, and I want to kind of marinate on this. You continue to use the words healthier and not
Yes.
prettier or done up.
Yes.
And I want to take just a minute. You kind of talked about it, but can you explain to listeners what exactly you mean by that when you talk about, I don't want to make you look prettier, I want to make you look healthier? How do we differentiate that? And where is that line of where I'm losing my focus and we got to get you back? Help us
Mhm.
understand that.
I would love to talk about this actually, because it is, I think, one of the most important things to my practice and the brand that I have tried to build in really trying to reshape how our culture and our world views aesthetics in the first place. Because for decades, aesthetics has been about making you look beautiful, making you look younger, making you look like XYZ, looking like XYZ celebrities. You know, your face should be perfect, your cheeks should be perfect, your lips should be nice and plump. Beauty is such a subjective term. Beauty means something different to everybody. And it's also a very internal thing. Beauty is, they say beauty is in the eye of the beholder. We have all these, phrases surrounding beauty. There's not one definition of it. And to try to force all of our patients into one kind of conceptual idea of what is beautiful, it's a losing game, because what's beautiful to one person isn't going to be beautiful to another person. And me personally, and we can die the same reasons I don't like to use prettier, the same reason I don't like to use words like anti-aging or looking younger. I know it's easy to say this at the age of 34, but I view aging as a privilege. Every single day that we're on earth is a gift, and
Right.
we should be thankful for every day that we get. So trying to constantly look down on ourselves for that extra time that we're given in this life on this earth, it's so counterproductive to me. And I just don't like that mindset of always wanting to look younger. Because if you're 40 and we make you look 35, what's going to happen when you're 45? We can't
Right.
make you look 35 anymore. Now we can only make you look 40. So you're always going to be losing that game. You're always going to be losing ground. You're never going to catch up if you're always thinking about looking younger, because the goalpost is always moving. But if we think about making your skin healthier, it's just like anything else we do in our lives. Maintaining a good diet so that we are healthier, keeping a good exercise routine so that we are healthier. None of those things are to try to look younger. They're to try to optimize our bodies in the state that they're at. And viewing aesthetics from that point of view gives patients so much more control in their lives, and it softens the blow of the aging process so much, because they're able to feel like they're actually staying on top of themselves instead of always trying to play catch up,
Yeah.
and keep up, with culture, with social media, with everything they see online and in television. It takes out the external validators and it moves it internally. And that's why that is so important to me. And that's what I really hope that this industry becomes over time.
Well, I'm going to tell you this. I think your thought process, your mission for your brand, where you're going as far as your treatment for your patients is very progressive. Um, I share that same thought with you. I really do hope that the rest of the community gets on board with that because you could not have said it any better. There is pressure, there's a lot of expectation because of social media, because of, like you said, what people want or what they think they should look like and what celebrity they think they should look like. And they're trying to mold themselves to look like someone that they are not. So, what you're doing is you're setting expectations to be what you think is a level of perfection that you will never achieve. So, you will always
Mm-hmm.
continue to disappoint yourself. And as a provider, you will always continue to disappoint the patient because you are trying to put it out there that you can create something for them that you will never be able to create. So kudos to you for setting expectations right off the bat, what should be, what their focus should be, and helping to guide them with that. Because that's not always something that patients understand, right?
Yeah.
They just like you said, because this is a beauty industry and everyone views that word beauty very differently, their vision or their goals might not be in line with reality. And you being the provider, the expert, it is really up to you to educate them and guide them. And I I think it's great that you're doing that. And why I said I think you're a little bit more progressive in this is because there's still a lot of providers that are not exactly there yet. And but I will say I'm seeing more of this language, right? I'm seeing
Mm-hmm.
more of skin health and less of the, like you said, we're not going to talk anti-aging and looking youthful or young. We're going to really focus on being healthy. But have you been hearing a lot of this word lately? And it excites me, but I mean, the word longevity. That is like something that I'm hearing way more now. And that makes me happy because the word longevity is just something we haven't really necessarily thought about because it's been more of chasing perfection and chasing, anti-aging and looking young and not
Mm-hmm.
necessarily longevity. And to me, if someone would tell me, Sam, pick a hand, one hand you're going to have longevity, the other hand you're going to have you're going to look youthful. Well, I'm going for longevity because I want to live
Yeah.
longer. I don't care necessarily about looking like I'm going to get there. I want to actually be there.
Yeah.
So I appreciate your approach so much and not just treating male patients, but treating everyone, all kinds of, genders, skin types, colors, all the things, because we all need that. We all need healthy. And when you look at that, healthy is beautiful and it should be viewed that way. So I love that. I love how you're refocusing everything because that's what we need. So let me ask you this. When you have patients that come in to see you, let's say you have these goals for them, and maybe what they want is not exactly what you think they need. How do you approach that? Are you open to saying no? And have you ever had to? And how did that go? So tell me a little bit about that.
I say no all the time, all the time. The, for example, probably the most often time I say no is when people are complaining about their nasolabial folds. And I think most providers are on the same page on how we approach those these days because it is very different from how we did even a decade ago. We'd be like, "Oh, I have nasolabial folds. Okay, I'll just put a bunch of filler in it." Okay, well now you look like Homer Simpson, like that, or like that's just not a good look. I can always tell when somebody went straight for the nasolabial fold filler because their face is flat and it's all center heavy, and you can tell when they smile that it just kind of like flattens everything. It just doesn't look good. I can tell almost every time. Um, I mean, I assume there's just like we tell patients, there's good work that we don't notice, obviously, but I would say that's the most common reason I would tell patients no is like, I think want some filler right here. I'm like, no, we're not going to do filler there. We might eventually, but we need to do filler here and here first. We want to fix the problem, not the symptom. Um, so that happens a lot, and patients, just because they don't know, which they're not supposed to know. That's our job to know these things. They just see a problem, and They want the problem fixed. They don't always know exactly how that problem is supposed to be fixed. So it really is up to us not to just do whatever the patient asks. It's really important for us to get to the why of that. Like if someone comes in and says, "Oh, I want under eye filler," it's like, okay, well, why do you want under eye filler? Do you feel like you look tired? Are you even a good candidate for under eye filler? Or is your skin healthy enough to get, under eye filler? There's all these layers that we really need to dissect with patients when they come in, and that's led to me having an entirely different treatment plan laid out for a patient than what they expected. And sometimes they're not on board with that because it's not what they expected, or it ends up being a lot more of a financial investment they originally anticipated. But I'm not going to sacrifice my ethical responsibilities as a medical provider just because what they need doesn't fit their budget right now. No, I always find ways to try to help them, like with payment plans, using, rewards programs with the companies, I have a membership program that, helps bring costs down. So like I don't say, well, this is it, deal with it. Like, there are ways that we can work with it, without sacrificing our worth as a provider and our value with our treatments. Um, but yeah, sometimes you have to be afraid. You have to not be afraid to say, honestly, this is what it's going to take for you to get what you want, period. Like,
Yeah.
I'm not going to, pardon my language, but I'm not going to half-ass it. If we're going
Hmm.
to do this, I want it to be done right. And this is what it's going to take.
I
Usually
like
they're
that.
down for it. Sometimes they're not.
Well, I think too, your work, being able to really show your smarts and show that you know what you're doing and you're qualified to be here. I think that helps to just gain that level of trust to where they say, okay, listen, he knows what I need. But you as a provider not being afraid to say no, I think speaks volumes. I was working an event for one of my accounts, and I had a lady that came in, and I felt like we were talking for hours. She was a talker, but I loved it. And she was telling me that because I was asking, like, how long have you come here? Tell me a little bit about some of the things that you've done because we were just talking skincare and things that she needed, and she was wanting to switch things up. So I was like, well, tell me some of the things that you've done here. And she kind of said that. She said, well, I've done this and that. She goes, and I keep begging her to do this certain filler. And I tell her, I think it was like chin and something else. And she's like, but she keeps telling me no. And I said, oh my goodness. I said, well, she knows what you need. And she's like, and let me tell you this. She said, before I found this particular injector, she said, I had been to several other clinics in this area and no one has ever told me no. She said, and I bet you that's probably why I had to have all that filler dissolved. And I said, you're exactly right. And she was just explaining to me, it was just refreshing,
Yeah.
from a patient perspective to hear how grateful she was that
Yeah.
the provider actually said no. And she said, it really let me know that she's not here to just take my money. She really wants to do what is best
Mhm.
for me. So I like
Yeah.
that. And I like
I've
that
had that
you're
happen many times in my chair, where I explain it to, they're like, what about, do I need a little more? Do I need a little more lip filler? And I'm like, no, you don't. I'm not putting any in you. No.
it's
And they're
okay to
like,
say no.
okay, fine. Thank you for saying no. I was like, I appreciate it. But then, just recently in the last few weeks, I had a patient come in to do a consult with me. He was wanting some filler kind of in this area. He had it done before and he really liked it. He had it done another time and the provider did not do a great job and he wasn't happy with it. He had it all dissolved and he was wanting me to redo it. So we had a long conversation about my technique and how I would approach it and mapping him out and all of these just very uh, I it's hard to explain because I don't mind when patients ask questions. I would rather patients ask questions, but the way he was asking like certain very, very specific questions, like, do you use lift or contour? Do you use a needle or a cannula? What approach do you take? What angle do you go? Like where, how exactly would you inject my face? Well, why would you use contour? I had lift before and I liked it. Can we use lift? I'm like, okay, I don't mind the questions. We've had two consults at this point. You picked me for a reason. Ultimately, I need to know that you trust me
Yep.
because I'm getting the feeling that you kind of don't right now. And I get you had a really bad experience. I get it. You had a bad experience. You don't want to have to go through that again. I understand it. But there comes a point where we've talked about all of this a lot. Either you trust me or you don't. And it's okay if you don't. It is okay if you don't trust me to do the job that you want done. I have places I can refer you to. If you're that worried about it, you can, there's places I can send you that do injections under ultrasound guidance. And that may be a more, that option maybe feel more comfortable for you. And I'm okay with that, but I'm ultimately not going to do this if I even get the slightest inkling that you don't trust me, because neither of us are going to be happy in the end. So
That's amazing that you would not only recognize that because trust is important, but be willing to refer out. That's a really good provider. So I love that. All right, I do have a specific question for you, and I did a little bit of digging before we had this meeting
uh-oh.
because I wanted you to explain this. So I asked several providers. I also asked some males that are in my family. I said, when you think of males getting filler, what are you think where do you think they're getting it? Like, what do you think is a good spot for male filler? And you want to know what everyone said? The jaw. That is
Yeah.
what everyone said is what makes the male face is the jaw. So with all of the males that you treat, predominantly men, is that most of your filler spots? And if not, where else are men getting filler?
I would say I would say concept wise, like in theory, jawline is the easiest sell
Hmm.
because no one's like too worried about having, too much jawline. Um, I think some people's expectations with jawline filler need to be readjusted to some extent, depending on their facial shape and their volume, and a lot of other factors with the proportion. I think conceptually, jawline filler is the easiest sell filler wise. Absolutely. I think in practice, it the biggest thing is cost barrier because filler in the jawline does get quite expensive. Like for me, normally minimum 3 syringes, like 1, 2, 3, unless they already have a great chin. But
Hmm.
usually I say we need a budget for at least 3 on your first treatment, and then we may need to do more. So sometimes it becomes a cost barrier for a lot of people, but I do a lot of jawline filler. I would say honestly, just because of the trust that I've built in my client base, and they know coming in, generally speaking, that I know what I'm doing and I'm not going to steer them in the wrong direction. I would say the most often place I end up doing filler in men is right here in the cheek. Because they
Interesting.
start to, especially when you hit about 35, you start noticing those changes in the fat pads and the skin integrity. Things start to look tired because that's still the number one thing men and women come in for first is they feel like they look tired. It always starts with the eyes. Men, women, doesn't matter. It's the first thing pretty much everybody notices. So men start seeing that and they come in and they're like, oh, I'm looking a little tired. I'm like, okay, don't freak out. But I think some filler in the cheeks would be the best option for that. Um, I don't know, like other treatment modalities, are becoming quite popular for the under eye area, but sometimes just nothing's as good as just a little bit of filler right here in the anterior middle cheek. Like there's just nothing that can really replace that with the duration. It just has to be done right. And I think that I've proven to patients that they're safe with me. Um, so yeah, I would say generally in the industry, jawline filler is probably the most popular for men, but I think men are being more open to doing other things these days than before. Um, and that with the right trust built in, I feel like it's shifting a little bit. Does that make sense?
So, yeah, no, I'm so glad that you said that. I would have never thought the cheeks, but you're right. I mean, that's part of when you're aging and things are starting to sag and drag, what makes you look older.
Mhm.
Would you say that filler is the most popular thing that you do with your male patients, or is there other things? All right, you're shaking your head. Nope.
No, filler by far not the most popular. Most popular treatments I do for men are Sculptra and lasers, like my Cool Peel, which I love. Um, I eventually can work them towards filler in the end,
Mhm.
but it's a process sometimes because no matter what I say or what they've seen of my work or how much I try to explain to them that like it's going to be okay. Um, the a lot of times they still want to start with more natural things to improve their look. And then once those things go well and there's no issues and they're still looking normal and healthy, then they're a little more open to doing things like filler. So filler, obviously like the tox, like Botox, Dysport. Um, and then other than that, which is kind of the most common for everybody, I would say sculpture and laser would be
Okay.
my most popular for men. They
I
like
love
the
that.
idea of it being natural.
Yeah.
They like that there's nothing foreign left in their body after a couple of months. Once the sculpture's broken down, they like that it's their own tissue that's regenerating. It's a much easier sell for men who are more on the nervous side.
I love that. Okay, so I have a little lightning round question for you, but before we do that, let's talk a little bit about, and quickly, I know we have time is not on our side right now, but we talked about something when we were chatting, getting ready for this recording that I think we need to share with everyone. So, you and I were talking about your past history and different things that you did in your career that kind of led you up to aesthetics. And we kind of brought up Dr. Obagi and how, he worked in gynecology, he was a pathologist, and he did all these things that made him such an incredibly well rounded physician, skincare founder. So you had said something that I was like, that is so true. It really is not only helpful, but almost needed for aesthetics providers to have more of a well-rounded background. Um, can you kind of elaborate a little bit on that side, just from your perspective on why you think that's so important these days?
Yeah, absolutely. So I started my career as an intensivist in the hospital setting. I was trained in intensive care. I did all my rotations in P school and ICUs at Vanderbilt, and I worked in neurosurgery for a year. I worked in cardiac surgery for 4 years in Atlanta, Georgia. I was doing open heart cases. I was first assisting. I was doing all of this really intense stuff, and then I started doing aesthetics, kind of on the side. That's a whole nother story. We can talk about how I got, how I transitioned over. But I really, really think that previous my previous roles in medicine were the key to helping me become a really solid aesthetic provider just with my medical foundational knowledge, because so many there's so many people that want to go into aesthetics, and especially I see it all the time on like Facebook groups and things like that of people, I'm finishing up nursing school and I want to start my own aesthetics clinic. I'm like, don't do that.
Pause.
At least get a job first, because there's so much you don't know what you don't know until you realize you don't know it.
That's right.
Even just in terms of like thinking about vascular occlusions, like complication management in the hospital and ICUs is more important than knowing how to do the procedure in the first place. We tell all of our nursing students, we tell all of our, you know, what do you call them? Yeah, like all the students who come in and rotate through everywhere. We tell them if you don't know how to manage the complications, you shouldn't be doing the procedure. When
Mhm.
it comes to intubations, when it comes to placing lines, when it comes to operating and doing surgery, those things are so, so, so important. And that's not something people think about because they think of aesthetics as being, oh, it's just Botox. It's like, oh, it's just a little filler. But there's so much that can be gained from having a lot of medical foundation going on in your head.
Right.
Medications people are taking, diseases or chronic conditions they may have. It's just a whole different way of critical thinking that I think people who are new nurses in general, they lack that. You do not develop those skills in your first or even your second year of nursing. There's so much you don't know that you will learn on the job. And I think that if you're going to go straight into aesthetics, you need to acknowledge that there is a learning curve of medical knowledge that you need that is not necessarily just aesthetics based. Like you get experience learning anatomy, knowing how to do research and how to look up best practices and how to do all of these different things that translate to aesthetics. And if you don't take the time and respect the profession as a medical profession, you're setting yourself up for failure.
That's right. And honestly, just with the way that things are playing out, especially with lots of misinformation that's all over social media, patients right now need providers that they trust. and they need to know that you are educated, you're experienced, you're well-rounded. That goes a long way, especially when you are educating and you are, helping to guide your patients. Like, for example, just to bring up Dr. Obagi again, like he has a very unique approach to treating the skin. So
Mhm.
unique that people look down on it. But when you
Yep.
know his background and understand that this man was a pathologist, he understands the cellular makeup of the skin, of these cells.
Mhm.
He truly, truly understands, and that makes him extremely credible. And that's why we get the results that we get.
Yeah.
So I feel the same with you guys, with these aesthetics professionals, the ones that are well-rounded and have this like vast experience. They have all of this under their belt. It just makes you a more trusted and well-rounded and qualified professional. So I'm so glad we talked about that, because yeah, it's definitely something that I think it needs to be said, especially because now everybody wants to be in aesthetics, but
Yeah.
we don't
And
anyway.
again, like I said, it's not that you can't be a good provider without bedside experience. You can be a good aesthetic provider without bedside experience,
Right.
but only only if you respect your job as a medical professional first. First and foremost, you are not an aesthetic practitioner. You are a medical professional. And you need to have respect for that position and that title before you know, jump into the deep end, so to say. So if you respect the position and you respect what you need to learn, you can be an incredible aesthetic provider, but you have to recognize that.
I love that. Okay, quick lightning round of questions for you. All
Oh
right, here
boy.
we go. One aesthetics trend that you would love to see disappear.
Oh, mm, I'm gonna ruffle some feathers with this one.
Give it.
Plastic
Give it.
surgeons trying to scare people out of getting filler and trying to convince them to do fat grafts.
Ooh, okay,
Um,
interesting.
there's you can't reverse a fat graft. You can reverse filler.
All right,
That's
that's
just
look. Hey, I like
yeah.
it. I
That's
like
that's probably a big one for me right now. That one's been bugging me a lot.
it. All right, fair. All right, one thing every patient should know before pursuing treatment, maybe specifically with you.
No one is going to force you to do anything.
Love it.
No one's going to force you to do anything. My consultations at this current point are free. Other people's are not free. So, with other people, the worst you lose is a little bit of money, but no one's going to force you to do anything that you want to do, especially me. My rule of thumb with patients, if it doesn't bother you, it doesn't bother me, except when it comes to your skin. If your skin's unhealthy, I'm going to tell you your skin's unhealthy. Um, so yeah, I would say
Okay.
that
And what would you say confidence starts with?
confidence starts with loving and accepting yourself.
I love
There's
that.
nothing I can do in this office that's going to make you love yourself more. There's nothing I can do in this office that's really going to help you feel more confident in the way that you present. You have to internalize that confidence first, and then we can improve some things if they bother you. But I would prefer that my patients feel confident and happy with who they are on the inside first, because nothing I do on the outside is going to change what's on the inside.
That's right.
You can feel more confident in the way you look, but you have to feel confident in the way that you feel.
What a great way to end this episode. I think that's amazing. Okay. Well, you are a gem. I think anyone in your area that gets to come see you is definitely blessed. You're a wonderful provider. You have a kind soul, a good heart. I really appreciate you spending some time with me. And if anyone wants to find you, can you give your handle and tell them if they're in the area, if they want to make an appointment with you, where they can go?
Yeah. So my Instagram handle is BeautyFX by Jamison, beauty, the letters FX by Jamison. My website is the same, beautyfxbyjameson.com. You can look me up on Google Maps, Instagram, my website. There's my phone numbers, my Instagram, my email. There's all of it's on there. And yeah, I'm right here, right in the middle of West Hollywood, right near the Sunset Strip. So pretty central location to a lot of people in the area.
Well, thank you so much. I am so grateful to have you. I know my listeners are probably going to gain some little gems from this. So thank you so much. And thank you everyone for tuning in. We will get this aired. And listen, if you guys are on Instagram, follow Jamison. His work is amazing. His little educational posts are wonderful. It's just, he brings a lot to the table. So hopefully you guys get to enjoy all the Jamison funds like I get to. All right. Thanks, guys. Y'all have a good one. Take care. Bye.
Thank you for having me, Sam. I appreciate it.
Think of the Skintrovert as your aesthetics roundtable, not a training manual. This podcast is for professional education and discussion. It's not medical advice. Your scope of practice matters, regulations vary, and your license always leads. To continue the conversation, follow the Skintrovert on Apple, Spotify, or any platform that you listen to your podcasts.